SFGovTV, as well as the SFGovTV YouTube channel. We respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and video is disabled. The video will be on for these speakers only. To participate in chat, please select the chat button at the bottom of your screen and send any questions to Q&A Mary Ann Thompson. Live transcription and ASL interpretation are available. To activate live transcription, select the More or the ellipses 3 dots buttons at the bottom of your screen and click Live Transcript. The ASL interpreter will be spotlighted for the duration of this event. To view the ASL interpreter as a larger thumbnail during a slide presentation, please click on the View button in the upper right-hand corner of your screen and change to side-by-side speaker view. At that time, you can also use the center divider to enlarge one over the other. Once the slides conclude, please return to speaker view. We have updated San Francisco's Safer Return Together health order to include a number of important changes that will protect our communities, pull us out of the pandemic, and allow our businesses to continue to bounce back and thrive. Starting this Friday, August 20th, proof of full vaccination status will be mandatory for patrons at certain inside businesses and all large indoor events. Employees will be required to show proof of full vaccination by October 13th to give time to meet requirements of their employment. We are doing this for public safety, and we are doing this to keep our businesses open. More information on the new health order and mandate will be shared during today's webinar. We recognize that there may be members of the media joining us on today's webinar. We will be prioritizing questions from businesses and members of the public during Q&A. The media are welcome to follow up with additional questions they may have at sfgovjic@sfgov.org. This is our agenda for today. And I now hand the floor over to Director Kate Sophis of the Office of Economic and Workforce Development. Director, the floor is yours.
Great, thank you very much. Thanks to everyone for being here, and especially to the virtual JIC team for producing this webinar. I am Kate Sophis, the Director of the Office of Economic and Workforce Development, and I am pleased to be able to be the host for today's webinar in partnership with the Department of Public Health, Mayor London Breed, the City Attorney, and our small business leaders to provide all of you with important information in advance of the new health order, which takes effect on August 20th, also my birthday, for customers, and October 13th for employees. As with our last several webinars, we aim to give you as much information about our current health order and what we should expect as we move forward. The transparency in the city's decision-making and our commitment to continuing to offer as much notice as possible has been a key priority for OEWD and for our mayor. We've also had a fantastic partner in Dr. Phillip, who we will hear from, and the Department of Public Health in supporting this goal. For our part, OEWD continues to make as many resources available to businesses as we can. It is our mission to help San Francisco's small businesses, workforce, and development sectors in navigating this economic recovery and health recovery. I know it's been a long 18 months in San Francisco and across the country, and it hasn't been easy. For all of you in attendance today, we are speaking at a critical moment when COVID and the Delta variant is once again creating uncertainty. I do not want to understate how challenging this past year has been or the difficulty that COVID created, but I am so proud of where we are now as a city and in our business community, and I am so grateful for the commitment and partnership of all of you in coming together to protect our city. So as I speak about commitment, there is no person who is more committed to the health and well-being of our city than our Mayor, London Breed. And it is my great pleasure to give the floor to you, Madam Mayor.
Thank you, Kate, and thank you all so much for being here. I know it's been a long road, and while we're in a much different place than we were a year ago, the new Delta variant has really affected our city and our country. From the beginning of this pandemic, San Francisco has led the way in our efforts to keep our residents and small businesses safe. At every stage, we've used all of the tools available to us, whether that was instituting the first stay-at-home order, setting up our own testing network from scratch, or requiring masks to prevent the spread of the virus. And now we are staying protective and protecting both residents and businesses with our new health order. At this point in the pandemic, we know that the single most effective way to keep people healthy and are out of the hospital is for them to get vaccinated. We've consistently had the highest vaccination rates of any major city in the country. And as of today, 79% of eligible San Franciscans are fully vaccinated. But the Delta variant is now here. I am getting calls on a regular basis, hearing about friends who have passed away because they contracted COVID. And sadly, in every conversation I've had with a family member or friend, none of those people were vaccinated. Our latest data tells us that our average daily new cases have increased to 203 new cases every single day, with 115 individuals hospitalized. We've seen a rise in cases in San Francisco. And if you are not vaccinated, this is just the most dangerous time in the entire pandemic. If you're not vaccinated, it's not a matter of if you will catch the virus, it's now a matter of when. What we know is that vaccines work and they will help keep you safe. They make it significantly less likely that you will catch the virus. And if you do still get infected with COVID, it will almost certainly keep you out of the hospital. We want to be able to keep our community safe, and we don't want to go backwards to the types of restrictions that we saw before. So if we want to continue going about our lives, eating at restaurants, going to bars and enjoying everything that San Francisco has to offer, we need people to be vaccinated. This is how we can protect both workers and patrons. Our businesses recognize this, and they've been leading the way. A number of bars and restaurants and other small businesses have been operating and requiring vaccines for some time now. And last Thursday, we announced that we're following their lead by instituting new vaccine requirements that will require people visiting businesses in a number of indoor settings like bars, restaurants, clubs, gyms to show proof of full vaccination. This requirement will go into effect this Friday, August 20th. I've heard from a number of business owners and employees at those same businesses who are so happy with this decision because it no longer means they're instituting these decisions on their own or risking being one of the only of a handful of businesses with these requirements. At the same time, we know that with any change like this, it causes a number of new challenges for small businesses, and that's why we're here today. Dr. Susan Phillip and her team are here to discuss further details about our amended health order, what it means for our city and the support that is available to help you implement these new requirements. I want to be clear that this is not just about the current surge. We know that we're going to be living with COVID in some shape or form for the long haul. We don't know exactly what that will look like, but we know the vaccines work and they're safe. We want to see our schools and businesses stay open. Vaccination is how we do that. We're going to continue to work with our businesses through this transition to make sure it is as easy as possible for them to get vaccinated. I ask everyone to have patience. Do your best and try to be kind to one another. We've had overwhelming compliance with our health orders in the past, and we expect that to be the case again because San Franciscans have done their part from the beginning to keep each other safe. I have no doubt that will continue. Our goal is to start with education, like with this webinar, to make the requirements clear and easy to follow. The way we can continue living our lives in some sort of type of normal fashion to continue keeping our schools and businesses open and people employed is for everyone to get vaccinated. Otherwise, we're continuing to expose people to an unacceptable level of risk. So let's all get vaccinated. Let's stay healthy. Let's keep each other safe. And let's get back to experiencing everything that makes San Francisco such a great city. Thank you all again so much for joining us. And I want to return it back to Kate Sophus.
Thank you, Mayor Breed. Your efforts in getting San Francisco vaccinated is a key reason why San Francisco remains a leader in the United States when it comes to overcoming the challenges of this pandemic. In fact, I recently read if San Francisco was its own country, we would be the second most vaccinated country in the world, thanks to your leadership. Speaking of leadership, I now have the privilege of introducing our health officer, Dr. Susan Phillip. Dr. Phillip has been so instrumental in leadership and in these webinars, and we truly appreciate the work that she has done for our business community. Dr. Phillip, I hand this to you.
Thank you so much, Director Sophus, to you and to your team for hosting this webinar and this discussion, and also to all of the staff in the Joint Information Center for producing it. Could I have my slides, please? And I also want to acknowledge and thank Mayor Breed again for all of her leadership and for the comments that she made, which you're going to be hearing me emphasize some of these again, because she truly made the key points of what we are doing and why, and we will go into some more of the details. I also want to thank all the businesses, the staff, and all the residents of San Francisco who have weathered all of the curves that COVID has thrown at us from the beginning. And as the mayor said, you all are what has made the success of San Francisco, which is a model nationally and worldwide, possible. And I do believe that we will continue to partner together, public health, the city, businesses, and community members to continue that progress. Next slide, please. So why are we here to talk about this new order and these vaccination requirements? Well, the mayor really summed it up very well. We are now in a surge, a continued surge that is our third highest peak in average new cases in August that we have ever had. Hospitalizations, not shown here, also increased during this time. And again, one of our goals from the beginning of the pandemic was to limit the number of people who had severe illnesses or who had to be in the hospital. And we have 111 people in the hospital as of last week, including 38 in the ICU. So the vaccination effort has been our priority from the beginning since vaccines were available. And as you heard from the mayor, San Francisco has done an amazing job getting 79% of our eligible residents fully vaccinated. But as much as we can do to increase our safety level, of increasing those levels of vaccination, that's what will help us not only come out of this current surge, but give us the best possible standing for any surges, any curveballs that this virus might throw at us in the future. So we're doing this to ensure our safety now and also for the future. It also, as we heard from Director Sophus and the mayor, allows us to not do what we did in the winter. At that highest peak, everything, nearly everything was closed. And again, economic health is public health. So we will take these steps that we have taken in order to allow our economy to thrive, to support our children who are now back in school, which is wonderful this week, and to keep moving forward. Next slide, please. So with that being said as the background, I will quickly touch on the changes that are coming and then go into a little bit more depth in each one. And there are 5 major revisions that we want to talk with you about and new things to know. The first is that the Safer Return Together order requires vaccination verification for patrons and staff in certain indoor public settings. So these are establishments and events where food and drink is being served, and establishments that are gyms or fitness and recreation centers indoors. Second, there's a new category of large indoor events that includes 1,000 to 4,999 people and requires the same vaccination verification process as indoor mega events, which are defined by the state as 5,000 people or more. Third, it conforms to changes that are in the recently issued new state health order that requires mandatory vaccinations for employees in certain healthcare facilities. Fourth, it additionally requires vaccination among personnel in some additional settings, including adult daycare, adult day programs, dental offices, and home healthcare workers that are providing medical care, as well as for pharmacists. And then fifth, it requires businesses subject to the vaccination requirement to post signage, both for their patrons and for staff. Next slide, please. So going back on the first point, vaccination verification for patrons and staff in certain indoor public settings. This applies to settings that are operators or hosts of establishments or events where food or drink is served indoors, including restaurants, bars, clubs, theaters, and entertainment venues. Also included are fitness establishments, including gyms, recreation facilities, yoga studios, dance studios, and where patrons engage in exercise involving elevated breathing or cardiovascular, aerobic, or strength training. Proof of full vaccination and photo identification is required in these settings for patrons who are 12 years of age or older. So what is an acceptable proof of full vaccination? There are multiple ways in which these can be verified. A CDC vaccination card and an electronic photo or a copy are also acceptable. Documentation of full vaccination status from a healthcare provider. A digital record that's been issued by the state of California or an approved private company, or similar documentation issued by another state, local, or foreign governmental jurisdiction. The compliance dates by which this must happen are August 20th, this Friday, for patrons, and October 13th for staff of these establishments. Next slide, please. There are some exceptions for patrons and for staff. So for patrons may use the outdoor portions of the business without vaccine verification. So for instance, a patron could sit at the outdoor tables of a restaurant or bar without having to have vaccine verification. Also, individuals who order, pick up, or pay for food or drink to go may do so wearing a well-fitted mask without vaccine verification. The exceptions for staff include individuals who enter or work in a business on an intermittent or occasional basis or for very short periods of time. For example, someone who delivers goods or packages to a location, they are not required to show proof of full vaccination. Then there are limited exceptions under state and federal law, including for religious or approved medical reasons. Businesses must maintain records of staff vaccination or exemption status. Next slide, please. So the second change is that there is a new category of large indoor events with a vaccine verification requirement. So as a reminder, as we said, currently the mega events as defined by the state are indoor events with more than 5,000 people or outdoor events with more than 10,000 individuals. And these are subject to requirements under state rules. So new under our San Francisco health order revision are for indoor mega events, personnel and patrons age 12 and up must provide proof of full vaccination. So no longer are people allowed to have a negative COVID-19 test or as a substitute to documenting full vaccination. Neither can they self-attest, just merely check a box or sign and say that they are fully vaccinated. It must be documented and shown. For the large indoor events, which we have defined as between 1,000 and 4,999 individuals, vaccine verification is also required for patrons age 12 and up. No longer allowed, again, is a negative COVID-19 test or self-attestation of full vaccination. Proof of full vaccination is required for performers and staff in these locations. There is a limited exception for visiting performers and staff if they satisfy certain COVID-19 safety precautions, such as testing with a negative test result, masking, and distancing. The compliance dates for these requirements are August 20th for patrons and October 13th for staff. Next slide, please. Third change or update is that we're conforming with the new state health order requiring mandatory vaccinations for employees in healthcare facilities. And on the left is a list of those facilities in which vaccination is required. I will not list all of them. There are exemptions, as I mentioned, for religious belief or a qualified medical reason. The compliance date is September 30th for employees in these settings to be fully vaccinated. Next slide, please. And then additionally in San Francisco, we added vaccination requirements for personnel in some additional clinical settings or settings where there might be more vulnerable patrons. And these include adult care facilities, adult day programs that are licensed, dental offices, home health care workers, and also pharmacists as a profession would also be required to be vaccinated. The compliance dates here are September 15th for businesses and governmental entities with personnel in high-risk settings must ascertain vaccination status, and October 13th, the personnel are required to meet the vaccination requirement. Because these dates are complex and the interplay between them can be confusing, there is a chart, and we will have a link in the resources to the general site where this order can be found. And there is also a chart that outlines the different dates and different settings and requirements. Next slide, please. And then finally, a signage requirement for businesses subject to vaccination verification for both patrons and staff. The signage for patrons must be posted at the entrance to the facility, informing individuals that proof of full vaccination is required to enter the indoor portion of the facility. And for staff, the signage must be in employee break rooms or similar areas, informing staff that they are required to provide proof of full vaccination by October 13th of this year, and informing the staff how to obtain additional information about getting vaccinated. The compliance date for these postings is August 20th. Next slide, please. So here are some of the images, and here is the link where the resources will be available and are available. Next slide, please. So here are the resources. I'm looking forward to hearing from the rest of our expert panelists and to answering any questions. And once again, I want to thank you in supporting San Francisco to be a leader in returning together safely and keeping all of our residents safe, all of our businesses open, and this is yet another step in that process of doing that very important work together. Thank you.
Thank you, Dr. Phillip, for your continued participation in these webinars and for your continued leadership through this pandemic. Next, I would like to introduce Deputy City Attorney Peter Keith and Patrick Fosdahl, who is the Director of Environmental Health, and they will inform all of you about the necessary signage, forms, and templates for the upcoming health order, as well as importantly discuss exactly how we should be checking the vaccine status of our customers and our employees. So with that, Patrick and Peter.
Great. Thank you, Director Sophis. My name is Patrick Fosdahl, as it says on the screen there. I'm the Director of the Department of Public Health's Environmental Health Branch. Just by way of background, the Environmental Health Branch is the regulatory branch for the Health Department. It's made up of about 30 different regulatory programs which enforce the nearly 50 different health codes in San Francisco. When the COVID emergency was declared, we added the enforcement of the health orders and directives to the work we were already doing. Like most of you, we all thought enforcing those health orders was largely behind us in June. But for all the reasons Dr. Phillip outlined, we are once again asking for your cooperation helping to end the current surge that we're in COVID cases. Next slide, please. As Dr. Phillip mentioned, but as a reminder, there are two key dates for you to be tracking. The first is this Friday, August 20th. We are now asking all owners of businesses that serve food in indoor environments like restaurants, bars, clubs, theaters, entertainment venues, as well as indoor gyms, yoga studios, and other fitness establishments to have in place procedures for checking the vaccine status of all patrons 12 years of age or older. You do not have to hire or designate an employee to do these checks. But at the time a patron first interacts with a member of your staff, the check should be made. So if you're a business with operating a small restaurant by yourself, you don't have to do the check at the door, but could do it, for instance, when the patron came up to order a meal. The second date is for the employees working in those indoor environments. As soon as possible, but no later than October the 13th, business owners will need to verify that any employee working indoors has been fully vaccinated. There's some limited exemptions which require the employee to submit a declination and get tested weekly, as was previously discussed. Employers need to maintain a record of staff vaccination or their exemption status. Now, after August 20th, the Environmental Health Branch will be responding to complaints regarding businesses that are either not checking the vaccine status of patrons, entering those indoor environments, or are not requiring masks. So following the issuance of any of the previous health orders, we've experienced an increased volume in 311 complaints. So please keep in mind that your customers do care and they are watching. Last year, we responded to over 3,000 311 COVID-related complaints. Next slide, please. We do recognize that these are brand new requirements, and we are among the first cities to impose this type of a standard. So we're going to start by trying to ensure that everyone understands the requirements through education and outreach. We do this by sending out email blasts of information to all permitted businesses. Many of you likely have already received one of these emails. We also answer a tremendous number of questions and conduct site visits and webinars like the one today. We take this education first approach because we really need your cooperation. We have learned long ago that enforcement will only get us so far, but through forming partnerships with the business community, we can help ensure everyone's health and safety. Having said that, when education fails, we are authorized to enforce the health orders. Next slide, please. You can see the enforcement tools listed there. Throughout the pandemic, the Department of Public Health has worked very closely with the City Attorney's Office, and you will hear in a moment from Peter Keith, who heads up that team. Working with them, we have developed enforcement tools to help gain compliance. These include a notice of violation, which generally includes a description of the health order violation along with a description of how to correct it. These have a very short correction time, which is generally immediate to less than 24 hours. We can also require business to close until they have updated their health and safety plan in a way that ensures compliance. These updated plans will need to be approved by us here at the Public Health Department. Closure notices are typically issued for repeat violations. So if you've been issued a notice of violation, please take the time and make the necessary steps to ensure that it doesn't happen again. We can also issue fines up to $1,000 per day per violation. So these can add up pretty quickly. It's worth noting that businesses violating the health orders are also putting their other permits at risk, like those issued by the Alcoholic Beverage Control or ABC, the Entertainment Commission, to name just two. As I said earlier, however, our goal is to gain compliance through education and outreach. As the mayor said, we've been very successful at this. Historically, here in San Francisco, we have a business community that is very cooperative, but we do have those enforcement tools if and when they're needed. Next slide, please. I just want to close by acknowledging, as the mayor did, that I know that this is hard. We all thought that we had largely put COVID behind us with the end of the state tiered color code system and the vaccine rollout. But COVID has come back with the current surge, so we're asking you to respond once again by partnering with public health around these new standards. I want to thank you for all that you've been doing every day to fight this disease. As the mayor said, the business community here in San Francisco has really been leaders in this regard. I'm now going to turn it back over to Director Sophis and Peter Keith from the City Attorney's Office.
Great. I think, Peter, you can just go ahead.
Great. Thank you.
Great.
Thank you, Director Sophis and Director Fosdahl. I'm Peter Keith. I'm a Deputy City Attorney with the City Attorney's Office. And I along with my other colleagues in the office, we've been doing everything we can do during the course of this pandemic to support our public health leaders and the mayor and our other leaders trying to get our way through the pandemic. And that includes the business community. I want to express my appreciation for everyone who's coming to this webinar because they want to find out what they need to do their part to stop this pandemic. So our office does two major functions related to the health orders. First, we help Dr. Phillip and their team put the health priorities and their health directives on paper. We help anticipate the questions that might come up, and we do our best to try and be very clear about what businesses' obligations are. We want to ensure that all city agencies are giving consistent, correct advice, and we want to make sure that everybody out there who's getting that advice, that all different businesses are hearing the same thing. You know, the burdens that we all face in terms of trying to comply with the health order, they're tough. And we want to make sure that everybody is in the best position we can put them to comply with the health order. And I realize a lot of the issues that come up around the health order, they can be tough. And we don't have all the answers. I think some issues you may have to be relying on your private counsel, but we will be as clear as we can be about what the city expects under the health order from businesses in the city. The second piece of what our office does is we support Director Fosdahl and his team in education, compliance, and enforcement. And again, I think as everyone has said here, San Francisco has been a model throughout the pandemic, and not just in our respect for public health, but in the way that business has really gotten behind all the measures we need to take to stay safe. You know, Director Fosdahl mentioned the 3,000 complaints that his team responded to. Other city agencies have responded to thousands more complaints during the pandemic concerning compliance with our past health orders. And, you know, our overwhelming response to when folks from the city show up at businesses, from the businesses is, oh, well, what can we do to comply with the order? We're glad to do it. And I want to thank everybody here because we know that you're here because you want to comply with the order. But as Director Fosdahl said, we don't always get compliance. And you know, as he indicated, The Department of Public Health has an escalating set of enforcement steps that it can take. Our office advises them in connection with that. And if their tools don't get compliance, then our office will. And so that's our role. And I think, again, businesses here in San Francisco want to comply. We have very few outliers where we've had to resort to going to court or taking other measures. But rest assured, we're here to do it. And it's not so much to punish the businesses that aren't complying as it is to make sure that it's a fair playing field for all the businesses that do want to comply and all of you who are doing your part to help stop this pandemic. I want to thank everyone here for doing your part and for being here today. And I'm very glad also that some of our panel today includes people from the business community and from the San Francisco community at large. And so I'm glad that you'll be able to hear from them today as well. Thank you.
Thank you. Thank you, Peter, Patrick, and really appreciative of your continued interest and responsiveness to the needs of our business community. Finally, and then we're going to move on to Q&A, but before we do, I think it's important we hear from other members of the business community. And it is my privilege to introduce Bivette Brackett with SF Black Wall Street and Ben Blyman with the Bar Owners Alliance, who are both here with us today to talk about the new health order and to give their perspectives as business owners. So with that, the floor is yours.
Thank you so much for that introduction, Director Kate Solis. I just want to say that, we've all been affected by the current COVID-19 pandemic. And while some try to adopt to working online, homeschooling their children, ordering food via Instacart, others have no choice but to be exposed to the virus while keeping our society functioning. Our different social identities and the social groups we belong to determine our inclusion within society, and by extension, our vulnerability to the epidemics. Health equity is actually when all members of our society enjoy a fair and just opportunity to be as healthy as possible. And SF Black Wall Street has partnered with the Mayor's Office of Economic and Workforce Development, the San Francisco African American Arts and Cultural District, small businesses, and nonprofit organizations for over a year to promote culturally competent COVID-safe events. Our events and programs center around the specific needs of San Francisco Black community to promote this health equity. And in order for our community to survive and not lose another person to this deadly Delta virus, we are recommending that everyone complies with the current health orders and get vaccinated. Upcoming next week, the Black community, we will be hosting, and along with the African American Chamber of Commerce, we'll be hosting our first ever Black Business Summit in San Francisco in partnership with various city agencies, federal organizations, and corporate entities. In similar fashion to our Juneteenth Business Awards ceremony, we are mandating that everyone must be vaccinated in order to attend this event. And that is to keep our community safe. One other piece that we're adding to help our community who may not be vaccinated is we will be having our on-site mobile vaccination unit. While you may be able to get vaccinated on-site, that still doesn't allow you to come to our event because we also have a strict rule that you must be vaccinated at least 14 days in advance before attending one of our events. I wish everyone nothing but hope, love, and prayers right now. I know it's been a very difficult last year for everyone to be in the house and to feel restricted in some ways, but we must protect each other. And the only way we can do that right now with this deadly virus is to get vaccinated. Thank you.
Hey, thanks for having me too today, and thanks, Bivette, for those words. We represent about over 300 bars in San Francisco. There's about 500 individuals in our group, and we actually instituted a policy of requiring vaccinations a couple of weeks ago, and we did it not because we wanted to be first, not because we wanted to make a statement. We did it because we needed to do what we had to do to protect our staff and their families. and to protect our businesses. We had noticed a number of breakthrough infections with staff members across the bar community. People who were vaccinated were coming down with COVID. Thankfully, none of them went to the hospital, but there are very, very real world consequences to that. And I think a lot of times some people consider this issue in hypotheticals or kind of in a scholarly big brain way, but for us, it was very, very real. And first of all, just because our staff doesn't go to the hospital doesn't mean they don't have young children at home or elderly parents or people with compromises that can't defend themselves against the virus. And the idea that they would bring it home to them is very serious. And second of all, if somebody gets COVID on your staff, they can't work. And there's a very real shortage of employees right now. They're out for at least 10 days. Usually it's more like 14. I personally had to close a bar one night because I couldn't find a staff member to cover for somebody who contracted COVID at a different bartending job. We have suffered so much in the last 18 months as an industry. And in the beginning, it was really because of a virus that we couldn't control. We know now we can control this virus, and vaccinations are the way to do it. So we are very thankful for the city for following our footsteps in doing this. It takes a lot of pressure off of us. We're thankful that they're partnering on this, that they made it flexible for the businesses so that we have the means to enforce it as works for each of our individual businesses. And we need to send a message, unfortunately, that if you want to participate fully in our society, if you want to put others in danger in close quarter settings, you need to get vaccinated ahead of time. So we thank the city of San Francisco for going through with this step.
Thank you both for representing the hundreds of businesses in our city. It's really thanks largely to the leadership of our small businesses and our neighborhood businesses that our health orders have been so successful. You've all protected your employees, your customers, and above all, set a visible and powerful example of how our residents and workers and visitors can stay safe. And personally, as the leader of OEWD, a lifelong small business advocate, and as the parent of children here in San Francisco, one of whom is disabled and vulnerable, I want to thank all of you on this webinar, all of you in our community who are together providing this leadership and commitment to keeping our community healthy. I know these orders are challenging and they're nuanced. And with that, I'd like to spend the rest of the time we have today to try to get to as many of your questions as we can. And my commitment, if we can't get to everyone's questions today, that we will follow up and we'll post on our chat closer to the end of this, the email that you can use to send your questions if we don't get to it all today. So with that, why don't we jump into our Q&A? And I'm going to start on the subject of our youth and our children. So I have two questions. One is, if I have a child who is over the age of 13 and they have proof of vaccination, can the parents attest to their identity, or do those teenagers also need to carry identification cards? And the second question is, if I have children under the age of 12, can we still dine indoors, or do we only need to eat outdoors? So two-part question about our young people. Maybe Dr. Phillip?
I'm happy to jump in if that's all right. So this is a really important question for children under 12 and over 12 who are vaccinated. So let's just start with the children who are not yet eligible for vaccination. Those children who are under 12 are not subject to these requirements. They are not required to have a negative test. They are able to enter these facilities with their families or with other vaccinated adults. The adults all must be vaccinated and show proof, but the children do not need to. The second question was, if there is a youth who is vaccinated above 12 and going into those establishments, they would have to show proof of full vaccination. But we recognize that they may not all have photo identification, as this questioner is pointing out. So in that case, really the business can use their best judgment, do the best they can. If the child has a school identification, even if it doesn't have a photo, that is fine. And parents can attest as well to the identity and the age of their children.
Great, thank you. A second set of questions is around establishments that provide certain physical services that may not be clear in whether they're covered with this health order. And so I want to raise, we have a few questions here. Tattoo parlors, occupational and speech therapists. What are the requirements for those kinds of establishments at this time?
This order really applies to the settings that we just talked about. So they are settings in which there is food or drink being served and consumed indoors, and settings in which people are recreating, are having a recreation facility, a gym, a fitness center. So, or also very large settings of 1,000 people or more. So those are the settings in which this order for proof of vaccination requirement applies. I do want to remind people that businesses can always be more restrictive than what our general order requires. So a given business that is not included under this order may decide that they also want to have a policy of requiring vaccination, and they are able to do that if they individually decide.
Great, thank you. We have a lot of questions about events. And I think in particular, when we have different establishments that are holding events but are not specifically event spaces. So here's one example. So an organization that teaches educational seminars where they don't typically serve a meal, but they might have free coffee and soda fountain drinks available for people to help themselves. Does that event now need to check everyone's vaccination status, as there aren't servers that would serve the coffee to check the status?
You know, I think in this situation, the answer is it depends. And what it depends on is if the food or the drink, say the coffee or the beverage, is going to be consumed in a gathering indoors. And in that case, they would be subject to the vaccination requirements. However, if the station were set up and people were instructed that they could consume it, you know, in an adjacent outdoor area, or if they took it to go somewhere else, then that would not fall under the requirement. So it really is specific to whether people are consuming the food or drink indoors in a gathering or other setting in which they're seated together or even standing together and consuming indoors.
Great. And that, I think, provides the answer to another question. Is this applicable to indoor venues that serve drinks and not food? And I'm guessing the answer is anytime you have to remove your mask indoors to consume something, food or beverage, it applies.
Correct.
Okay, great. Thank you for that clarity. And so that would even include an art gallery that would have an art opening and provide a beverage. They might not normally have to check for vaccination, but on the night that they have the opening, if they're serving food and beverage inside the gallery, would they need to check people's vaccination status?
Yes, they would if they had the food and drink indoors. And again, if they only had the food and drink outdoors and then people were coming into the gallery without eating or drinking, then they would not. So it does depend on where it's being not only served but consumed primarily.
Okay, great. And then we've talked briefly about there being the potential for a medical or religious exemption to vaccination. How, as a business owner, what kind of proof am I needing to have? And do those folks who have those exemptions, are they still allowed to partake in indoor eating or drinking?
So we know that there are a lot of questions about this particular area, and we will be working to try and provide as much clarity as we can. Some of these get into legal issues and protected areas according to people's medical condition, et cetera. So there might also need to be some discussion for people's own individual situation that we may not be able to, answer every question, but we will be working to try to provide as much clarity as we can, and also trying to point people to other resources, national groups, others that are working to solve these problems on behalf of businesses like the ones that have questions here in San Francisco. So I know that we'll provide much more information in the days to come. And what we will say is that, as you have heard from Deputy City Attorney Keith and Director Fosdal, our goal is really to try to work collaboratively with all the businesses that are working in good faith to follow these orders and to do the things that are being required of them. So I would say that the settings and the establishments should follow the orders the best that they can, and we will be refining this over time. And we have an understanding as well that these are not simple necessarily in every situation, and we want to be supportive and work in partnership to try and improve over time.
Great, thank you. So the next set of questions are about hotels, specific questions around different activities and areas within the hotel. So let me start with, I think, an easy one. So a hotel restaurant would need to confirm the vaccination status, an indoor restaurant for visitors wanting to dine. That is correct?
Correct.
Okay. And the employees working at that same restaurant would also need to be vaccinated, would they?
Correct. Yes.
If an employee sometimes works in the restaurant, sometimes works in other parts of the hotel, they would still need to be vaccinated if they were going to work in that restaurant, whereas they might not need to be with other duties at the hotel. Is that also correct?
That is correct. So it is specific setting within the hotel. And if it is an employee that, again, is just dropping something off or picking something up, and that's an incidental part of their job in the hotel, then they would not need to. But if it were a person that worked regularly in that setting, then they would. So the hotel itself, per se, the guests and say the people that work at the reception desk, the front desk, they would not necessarily need to. But specific settings within that hotel, and as you mentioned, a restaurant or a cafe or a coffee shop or a gym or a pool, if there are people that work in those settings and the people that use those settings, that would be a recreational facility and would also be covered.
That's actually answer to another question. So a hotel gym, there was some question about, it's not technically open to the general public, but of course it's open to hotel guests. But we should consider hotel gyms to be just the same as gyms that are available to the general public, and you would need both employees and users of that gym to be vaccinated?
Yes, that is correct.
Okay. Few more corner cases. So if I'm an employee and all I'm doing is delivering room service, I'm picking it up at the restaurant and I'm bringing it to a room, I do not need to be vaccinated.
Correct. That employee does not need to be vaccinated. That is considered the equivalent of takeout. They would have to wear masks. And for all of this, the baseline is that indoors, we're all wearing masks at this point. That is what the order requires, with limited exceptions. So that employee who's delivering room service is not required to be fully vaccinated or to show verification of vaccination. They would wear a mask during that brief encounter.
Okay, great. So I have some other questions about other community serving organizations. So one question is, if I'm a nonprofit, say providing an after-school service to youth of various ages, and I serve snacks to those youth, does that trigger coverage where I would have to have the youth over the age of 12 and my own staff vaccinated?
No, children and youth and those types of programs for children and youth are covered separately. So they are not under the same requirements of this order. They have their own requirements that are separate.
Okay, great. So pivoting as we near the end, this is maybe more of a legal question. So let's say I'm an establishment, whether I'm a bar or a restaurant, and I have a customer who literally refuses to comply when they come in the door, what do I do? Do I call someone? What do I do? What's the advice in that moment? And then if I have a continual problem, is there some longer term advice, legal counsel I should seek? Perhaps we could have one of our speakers address that.
So, I think in the same way that you would treat that you would respond to a customer who's hostile or aggressive for any reason, you should respond in this situation, whether it's calling 911 or, I know that, many of you here run bars and you have bouncers and you're no strangers dealing with unruly customers. And so, I don't think that the reason for a person's anger and hostility really doesn't matter. I'd say respond however you usually respond.
Great, thank you. And then one more question on a detail. If I have a visitor from another country, what should I be verifying if I'm not familiar with how they would provide proof of vaccination status from another country? Is there some guidance on that?
Yes, this is also, it also could be a challenge, but what the order permits is that we will recognize vaccines that are authorized by the World Health Organization. There are some vaccines that are approved in other countries, but not in the US. As long as it's approved by the World Health Organization, that is permissible and someone has been fully vaccinated. And again, proof of documentation from that foreign country is also acceptable as well. And as we go, we will try to see what resources we might be able to provide to make it easier to know what that current list includes.
Great. So I know we are just about at time. I want to maybe end with maybe an aspirational and difficult question. Without knowing the end of this pandemic, are we thinking that what we're trying to do is get everyone vaccinated and the payoff might be at some point we won't have to wear masks indoors, even if there is still COVID in the world? Is that, like, if we set an aspirational vision, is that what we're trying to get to, is we're vaccinated and we actually at some point might be able to not have masks indoors all the time?
I think that is a good aspirational goal. I think our immediate goal is to try and prevent as many serious illnesses and death and overall infections as possible as we can in San Francisco residents, to keep our businesses open, as we've all been talking about, through this surge that is devastating other parts of the country as we see now. And I think to the future, again, the more we can really build up our vaccination numbers, even better than we have. And maybe it seems like it's too pie in the sky to want San Francisco to even push beyond the 79%, but every little bit helps. And every little bit helps us deal with the current surge, but also any curveballs that this virus tries to throw at us in the future as well. So yes, all of this is really to allow us to get back to more of a semblance of normal. And that could include being able to remove our masks. So we're always looking to see what we can remove safely. And that will be one of the aspects that we're trying to get to.
Great, thank you. I wanted to, in my just closing statements, recognize that we're already hearing from members of the community, Golden Gate Restaurant Association, SF Travel, who are trying to come up with a way to sort of celebrate that we're vaccinated. I'm hearing a relax, we're vaxxed kind of campaign to uplift our businesses, not only because they're compliant, but in a way we're creating 1,000 points of safe spaces for our community and at some point for our visitors to be in. And I like that aspirational idea that even though we are in the middle of this moment in time and it is operationally and logistically challenging for so many of our businesses, what we're asking of you, I like the idea that we might also try to find sort of that positive piece of it that actually sets our city apart and our businesses apart and may actually in the end up driving more business to our businesses because we're safer than other communities. So with that, I know we are at time. I want to direct everyone to the chat. I believe we have posted two emails that you can email further questions to if we have not answered them today. If you have already put your questions in the chat, we have recorded those. I have tried to get through most of them. I know we didn't get through 100%, but I think we covered quite a few. And then there is actually a separate email as well for the media. And we will be, as always, following up. So that said, I want to thank again our presenters. I want to offer my personal and heartfelt thank you to all of you in the community who are doing what you are doing to make our city safer. We are in this with you. We are in this together, and we are committed to helping you navigate this. And as we continue forward to remaining very transparent and communicative with all of you as things change. So with that, I think we've come to a close and onward. Thank you very much.